This question, I only see half of it. It's cut off, but if I get a blue blocking intraocular lens, well, let's talk about the blue blocking intraocular lens. I'm sorry, I can't see the question on this one. The blue blocking intraocular lens came about 20 years ago or so. They've, for the most part, fallen out of favor. I think the only company that makes them is Alcon now. The blue blocking lens is yellow in color. It kind of mimics the color of a cataract. So, you would expect with a yellow filter that your vision will be a little yellower. Just, it's almost imperceptible, but to the surgeon, when we look at this lens, it has a light yellow hue to it. The idea is that yellow materials will absorb blue light, and so makes things look less blue to you when you're wearing it or having it implanted. Blue light, is thought to be, or 20 years ago, thought to be, somewhat harmful or potentially causing the retina to degenerate in some way. Blue light has higher energy than, red light. But I'm not sure how much that holds water these days. Most people say it's unnecessary. And 20 years ago, when this was a hot topic, it was thought to, the counter argument to the blue blocking lens is if you have blue blockers and blue light is what regulates your circadian rhythm, you may be putting yourself at unnecessary risk for depression, for sleep cycle disorders. That I also don't think is necessarily true. So I think blue blockers were kind of a fad for a little while. I don't use blue blockers. Nowadays, folks say, well, the reason we use blue blockers is no longer that, we think that blue light's harmful to the eye, but that, using a yellow filter can decrease the amount of glare inside the eye. So think of it this way. You have these hunters and people who shoot weapons, shoot guns, for sport. They wear these like orange or yellow glasses, and it's supposed to cut down on the glare. And so some companies may think that, and it may be true, that the yellow lenses can decrease the blue light, which scatters more, and create a better focus. So that part could be true. I've certainly done some yellow lenses in the past. In particular, we thought that the yellow lenses would help with cut down on the side effects, the rings in these multifocal lenses. And this, we did this many years ago with prior generations of these multifocal lenses, and I didn't see an appreciable difference between yellow and clear lenses in terms of rings at night around headlights. I think you're going to see it one way or another, and I don't think it takes it away, or it maybe attenuates it by an imperceivable amount. But I've certainly heard people talk about rings and see rings with the blue blocking lenses. Anyways, sorry I didn't know what the question was, but hopefully that answers your questions about blue blocking intraocular lenses. They're not commonly done anymore.